to the 8th class presentation in our series, and the 8th and final one. And then we've talked about, and we've mentioned in the past, that we will do another series later in the year, and so the odds are we'll put something like this out in with the utility bill again later in the year to notify you when we're getting ready to go on those. This is somewhat of a continuation from last week. First aid, Dr. Butler talked primarily about really nasty things, bugs and stuff that's crawling you and all that. But anyway, a lot of dental first aid, and very, very important. We appreciate that. And he again will be our main presenter this evening. I am going to do just a bit of an introduction and talk a little bit about some aspects of first aid. The thing, delving into a first aid presentation, it takes about a minute to start realizing how over your head you really are in, because we're not certified first aid instructors, and any kind of first aid course you go to or look at pretty much falls under the American Red Cross or something like that, but is a regimented course and is taught by certified instructors. So we're not pretending to be that. We are basically looking at giving an overview and just hitting some kind of highlights and important aspects that will be helpful. And again, with the goal of encouraging everybody to dig in, find out where their resources are, what they are, and where you can go from here to really get prepared in the case of some kind of an emergency or disaster, whatever it may be. I started kind of piddling around with my tablet, and I found an app that I thought was kind of interesting. If I can get it to come up, and so I'm very small, but American Red Cross app, and there's a lot of varieties of this, but there's the emergency section, and you can go to all kinds of stuff in here. It's really neat, but a long list of different types of emergencies may be going on, and they're in alphabetical order, and you can go to one, and typically there's choking, and it'll start asking you questions and taking you step by step through what you ought to be doing for somebody that's choking, and there's just a long list of those. So this is a neat app, and you can get them on your tablets, you can get them on your iPhones or the different devices, and it's really, from my exposure to it, a really good way to go to have that available. There's so many details to remember that unless, for me, if I'm not using something regularly, it gets tucked way back there, and it's not that easy of recall. But if I have something like that I can go to real quick on my iPhone or whatever, I'm going to be that much better prepared and that much better off. Wanted to talk a little bit about first aid from the very brief overview that we had of it as we went through our CERT training. And so that's what I've got up here. What I did is went into the CERT site by FEMA and downloaded the manual for basic CERT on here, and it's just a PDF thing, and that went back small again, didn't it? Stand in it. Anyway. But one of the things that they really drilled into us, and of course we need to keep going back and redoing, is in a disaster, especially however widespread it might be, but if we're going in and we are searching for victims, there are three main things that we look for on people that are injured. We look for what they call in the CERT manual the killers. And there are three things that they identify as killers, and thank you. And the first and foremost is, are they breathing? Airway. And if you really stop and think about it, if you can't breathe, nothing else matters. Nothing else matters at all if you can't breathe. So airway is the first one that always will show up on any list. And then bleeding, if there's out of control bleeding, and then the other one is you look for shock. And any one of those three things that go unchecked, wow, that's really done. We're in good shape tonight. Anyway, any one of those things go unchecked, they will lead to death, and quite rapidly, actually. So, anyway, I was going to spend a minute with airways, and then the main thing is with an airway, you want to make sure that it's open and they're breathing. So when you're checking to see if someone's breathing, it's like look, listen, and feel, right? You've all heard that. And so you look for, if somebody's unconscious, you would look for chest rise or abdominal movement. That's what you look for. A person that's laying on their back and they're breathing normally, what really goes up and down is the abdomen. And it does that because the main muscle of respiration lies right under here, the diaphragm, lies right under the thoracic cavity. And when we breathe in, it's because that presses down and straightens out, and it pushes our abdomen out. And then when we exhale, that relaxes and goes back up, and we exhale. So that is, you can see that happening if they're breathing. Listen, you can put your ear down by the mouth and nose to see if you can hear air moving, and feel. You can feel, like if you're right down there, to see if you can feel air moving on the cheek. If somebody, in the CERT program, we were taught we don't have time. We were taught we need to do the most good for the greatest number that we can. And if we don't have time to just sit there and work with an individual, our goal is to establish an open airway within 30 seconds. We do an assessment and correct the problem to where it's going to stop killing them within 30 seconds and move on to the next victim. To establish an airway, if you don't see any of those things, you want to make sure they have an open airway. And so you may have heard, I'm going to kind of scroll down here. This is, like I said, it's from the manual, but it does talk about some important things like there that's good to know. Ways to approach a victim. And if they're conscious, you want to make sure that they can see you. If somebody's a victim in any kind of an emergency or disaster, they're going to be in a bad frame of mind typically. We don't need to do anything else in approaching them that's going to upset them or cause more distress than they're already dealing with. So make sure they can see you coming. Identify yourself by giving your name, and kind of goes into more detail there. But ask for their permission if they're conscious, if you can help them. You want them to know that you're their friend and you're there to help. And then it talks about respecting cultural differences, and with some cultures it may be necessary to ask a male that's present if you can help the female, and that kind of thing. Then it talks about opening the airway and gives the main parts of the airway right there, and not necessarily in the order they come in anatomically, but there they are. But the main thing is we want to have an open airway from the nose on down to where the gas exchange takes place in the lungs. And it says here, an unconscious or semi-conscious victim, especially one positioned on their back, the most common airway obstruction is the tongue. And the tongue is a muscle, and if it relaxes, it'll fall back. And it's got some pictures. So there we go. So there's basically an open airway of somebody laying on their back. And so the darker color represents an open airway, and it shows the tongue there. And if it has relaxed to a certain level, it can drop back down to the back and obstruct the airway. And so we want to correct that so they can start breathing again normally. And so they talk about the head tilt, chin lift method, and that's just a matter. You have them on their back, and you want to, with the palm of one hand, lift the head, and with fingers of the other and under their chin, get under here and lift it. And as you do that, it pulls the tongue forward and establishes an airway. And that may be all it takes to get somebody breathing again. If they can be knocked unconscious and they're laying on their back, and because of that, that's relaxed. Stand.
Show us that again.
I could use them. Here, I need a dummy up here.
Oh, Todd, would you?
So, basically, head tilt, so on the forehead, pushing the head back, and the chin lift, and that helps to pull the tongue forward and obstruct the airway. And so, that's very important. And then you can go on and on from there. To get really in depth with this, we've got a lot of ground to cover. You really need to get into an official first aid course and or CPR training for this, and because you can get a lot more in depth. But that's very, very basic, but also very important.
At the Logan Hospital, they have a website you go on there, and they list when their next their classes are.
Oh, very good.
Classes, so you can pick which one you'd like to go to. You don't have to, because the closest Red Cross office now is in Ogden.
Oh, is that right? They don't have one here. So.
No, they used to have one, but
yeah.
they closed it. It's in Ogden now. So the best thing to do is, because I was looking for something as an emergency paramedic specialist, because I'm trying to encourage at least one person in every family to be first aid trained. You know, because if not, then there's a chance you're going to watch your children or your spouse die.
Yeah.
In front of you don't have the skills. So.
Good. Thank you. Appreciate that. Anyway, that's really, I just wanted that brief little thing. If you can establish an airway, get somebody breathing again, and there's more victims you want to move on to them, a way to keep from having them just go back to where you found them is you can put something under their shoulders and get creative. Grab whatever you can, but if you have their shoulders elevated, then their head is going to be tipping back and help hold that open. Another thing, if it's an unconscious victim, is what's called the, and now the word escaped me, maybe it'll come to me, but you roll them to their side with their head back. And what's that position called? Yeah. Anyway,
on the side.
On the side with the head back position. Anyway, the reason for that is because that will help if there's any vomit or blood pulling or anything back in there instead of going into their lungs and drown them. And that can help for it to drain out the side, and still by keeping their head back, keep the airway open. So that's some very, very basic but important initially. And then of course with bleeding, if it's out of control bleeding, you use the pressure, shock. You gotta warm them. There's a lot of details, but I'm going to go ahead and turn the time over to Dr. Butler, and he'll shift over to his presentation there. Does anybody have any other comments or questions before we shift? Okay, very good. Oh, I did want to say while we're doing that, we do have a bunch of these left over with all of the classes that are in here, and they are on the website, which is listed right there. And so if you want to grab one to have it with you, it'll give you a good reference as to what you can go find on the website.
A couple of good points were brought up from last week. Somebody asked why, if you're lancing an abscess in your mouth, why do you use a fish hook? It's just improvise. Find what you can that's sharp. And if you put a fish hook through, of course you want to take that barb off before you do that. But if you think about it, if you've had a fish hook in your finger, you usually didn't feel it till it's halfway through your finger. So when it's sharp, you don't feel it as much. And so somebody that you're helping out will appreciate that. Also on the penicillin, if you want to use it internally, you really should boil that, or not boil it, but put it in hot water, stir that up as a tea. It's the best way to do it. You can get a pretty big dose if you're just taking that big little slice of red meat. So you don't need that big of a dose. You're probably talking about 3 grams, and you need 1. Okay, if you're really doing that. So chop it in 4s, put that in your hot water, then stir that up, and then just drink the water.
So that's for internal.
Internal.
Use it
external, take it, just get it wet, put it against it. Yeah, don't get it sopping wet. Just get it so it's mold, so that it will move, and then put it on there.
And the internal would be for
you have strep throat, or you've got, we talk about we spoke a lot last week about trying to make stuff not go septic. We don't want to get it into our bloodstream because if we do, now we have a hard time getting rid of it. If we can prevent it from getting that far, we're miles ahead of the game. Much easier to keep something, to keep it out of the bloodstream than it is to get it out once it's in there, because it's a great place for bacteria to grow. I'm going to jump back and talk about colloidal silver, okay? And this is not from a dentist point of view. I was a biochemist that did biochemical research for years. And I actually worked with how enzymes and metals worked. And in all that time, I always thought that colloidal silver was an old wives' tale. And I never put research into it. And this guy, obviously, he thinks it's a wonderful thing. He's taken it till he's blue in the face. And it does deposit over time into your cells if you use it a lot. Okay. Now there's.
It stays in the cells. It doesn't come back.
Yeah, it's like a tattoo. Okay. And like when I look in somebody's mouth and they've got a spot in their mouth that looks like it could be a type of cancer. More often than not, probably 99.9% of the time, it's actually a tattoo that's caused by a silver filling. And it's actually the silver in the filling that causes the tattoo in the skin. So it will. It'll deposit in the skin and it becomes just like a tattoo. There's some different types of silver, okay? That first one is, basically that one is a prescription ointment, okay? And if you want to use it, you're going to have to get it from your doctor. He's going to have to prescribe, and it's a good topical remedy. And it is antibacterial, okay? And that's the little chemical formula up there on it. Okay, now silver.
What's the lifespan of that?
If you could get some of that ointment, I mean, it'd be like your zinc baby bottom stuff, and it's about that consistency. Your lifespan on it's probably, if you keep it in a cool, dry space, you're probably looking at 15, 16 years for a tube of that. It's not going to change that much. So, your next one on this list is silver ion. And I found that quite a few places that sell this on the market. Silver ion, when you mix it up, it's gonna react with chlorine. And so it's going to be a silver chloride, and it's going to have no effect whatsoever on an antibacterial, being an antibacterial product. It's not going to do anything for you. So you got to be careful when you're buying it to make sure that you're getting a true colloid. And what it is, milk is a colloid. It's small particles that are suspended in a fluid. And the action of the colloidal silver is actually, they try to make them nanoparticles, and basically they have a machine that grinds it down to a very fine powder. And when that's suspended in water, the surface area of the silver, and it has to be that pure silver, that's why it has to be a colloid to really work, will react with proteins. And they will inhibit proteins from dividing, and they'll also bind the protein and make it inactive. That's how it works as an antibacterial solution. And so you kind of need to know what you're buying, what you're getting when you get it, or else it's not going to work at all. You're going to think that you have something nice and it doesn't work at all. And I'll go into, I pulled up a piece on WebMD because the medical community has issued some statements on silver. But I went, and there's hundreds and hundreds of places that have done chemical testing on colloidal silver. This is one that's in New York City, and if we look on that, you can see you've got a fungus. That's the most common, the top one's the most common fungus that we find in our mouth. That when we have oral thrush, that's usually what it's from. Now, with their testing with the colloidal silver, within 24 hours, live fungus was undetectable. Also, with E. coli, staph areas, so staphylococcus, pneumonia, all of those when they did their studies, they couldn't find live bacteria after 2 days. So 24 hours, 1 day. Then jump down to that bottom one. If you look at vancomycin resistant staph, so this is one of those super infections that's in the hospital. When this biochemical lab did their research on it, they found also that within 24 hours that there was undetectable live cells. Okay, because it works because different antibiotics work different in different ways. We kind of talked about that the other day. This one binds the proteins and makes it so that the cell can't function anymore.
I went snowmobiling a couple weeks ago with a doctor, and he was telling me about a study they did up in Canada, and they were spraying the surgeries and stuff with colloidal silver. I'm going to get this study from him. I told him I wanted it, and he says they had 0 secondary infections when they did that. Because in America, we get 1 out of every 14 surgeries gets a secondary infection. 2 million people a year die from those. And so that sounds like a really neat deal.
Yeah, when we get to the end of this, we're talking about wound dressings. There are some wound dressings now that come with colloidal silver on the surface of it.
Really?
I'll show you one at the end of here. And like I said, I used to do biochemical research, and I thought this was a big farce. But then I mostly worked with ions. When I started looking at it the other way and looking at other research that has been done on it, that's not a wives' tale. It's actually good sound stuff that now the medical community is starting to go back and look at.
So can the silver only be applied topically, or is there a way that you can
No, yeah.
use that internally?
Well, like that guy at the first, yeah, he takes a certain amount of it on a daily basis, and I think it's the next slide. But yes, you can take it internally or externally. It works good as now it escapes me. We want it as a you put it on the outside of your skin. Make sure that you're clearing it. It'll sanitize your skin. Yeah, so we use it topically, or you're going to take it as, and some of these studies, as I read them, some of these studies were using about 75 parts per million with their 24-hour results, but they're saying that 5 or 10 parts per million, which is what you can buy it. If you're looking on a shelf, it'll usually be 5 or 10 parts per million. And I've seen up to 30 parts per million that you can just buy over the counter. And they are made for, and I would read it off the bottle, and that's what this actually, WebMD, I put this on here on purpose because they basically say on here that there is no mineral value, like we take magnesium, we take all these minerals to help for the health of our body. They're basically saying that there's no mineral value in silver, and I agree with that. That's not the reason why you would be using colloidal silver. It's not a mineral supplement. It's an antibacterial, and it kills a wide variety of bacteria. Matter of fact, if you look on the other side, this is also from WebMD. So even though they say at the bottom of this, it says it's misbranded under the law. I put that on there on purpose so you can read that. But if you look, they go in and say colloidal silver is used to treat infections due to yeast, bacteria, tuberculosis, Lyme disease, and it just goes on and on and on. So even though they put a disclaimer, even WebMD is telling you that there's all these things that it does work for. And like I said, bacteria, in the next slide, let's jump to the next slide. Here's a lady that she had, this was a methicillin resistant staph. And with spraying that on her face, this is her claim that it cleared her up, got rid of that. Okay? So this is a big deal because when they're resistant, and that's why I put this slide in next here. Okay, this is that methicillin resistant staphylococcus. Okay, that we're seeing pop up in hospitals, and they're basically telling you how to live with it because they don't know how to get rid of it. But there's certain groups that now have been using that silver colloid to eradicate it completely off their skin. This is what it will look like. It can have a variation in different forms to where it's a wide open bleeding wound. Okay, Yes.
Did I read that it does affect on the virus? It has an effect on viruses?
Yes, if you look, basically anything that has a protein, because the way that it works is by binding a protein. So anything that works through that mechanism, that's why it works so much different than other types of antibacterial things that we use. So really quick on MRSA, they tell you wash your hands often. I tell the kids in the schools I go talk to all the time, it's the thing that's going to keep them from getting the cold and the flu in the wintertime, is just washing their hands. Now, most of the time I tell the people, don't use antibacterial soap when you're doing that. Just use regular soap. Don't go seek out the stuff that has extras in it that kills 99.9. When you're doing your, as we go on further, when you're doing your first aid kit, that's what I want you to have. And there's a reason for that.
Okay,
That's what I would
which do you
recommend.
want us to have? The antibacterial?
I would say you want the antibacterial in your first aid kit. Don't use it the rest of the time. Okay? Just use regular soap. It's already antibacterial. But we kind of talked about that. The reason why it only kills 99.9% of the bacteria is not because you missed it, like a lot of perception is. It's because it was already resistant. And we don't want to keep making those resistant ones grow more and more. We want all of them to grow equally, because the good ones will stamp out the bad ones if we leave it that way. So first aid supplies, I'm going to put this on the web so that you can go in and download it. A lot of this came from, and I've looked at quite a few different sites. Mayo Clinic had an excellent one, but it was missing some stuff on it that I think that you need for an emergency situation. And so if we look at it, right here, the hemostatic collagen pack, okay? They're anywhere from $5 to $11 if you want the silver colloid in it. But I think you should have one, because if you have a big wound on somebody that's bleeding, this pack you can put against it. It has collagen in it, so you don't have to pull it away. And it's hemostatic. It will stop the bleeding even with the heavy. Somebody has an artery that's popped. This can help stop it with your pressure on it. Okay, just regular pressure with the Band-Aid, you're hoping that it stops in 15 minutes. If you buy the collagen one that's made out of collagen, and those are a little bit more expensive, you can put those internally and leave it. The body will absorb it and grow tissue through it. So,
This is different than the Celox kind of stuff that they pour in open wounds?
it's basically the same material. And I'll show you one at the end. They've now got, for Army guys that get a bullet wound, big wound in it, they've got a tube that they can put in there and inject it backwards, and it puts collagen in there with the hemostatic agent, stops them bleeding, and the tissues will grow through it. They're saving lives with this right here on the battlefield.
Where do we get this?
You can buy it. You can buy it just on eBay, eBay. You want to get it on Amazon. It's probably the cheapest place that I've seen it. And so when you go in and you get this list, because I don't think we need to go in and say, name every one of these things. There's some of them that I'd say good attention to, but what did I do?
What's with that picture?
Okay, that's a good question. Okay, one of the things I have on here, second one from the bottom, is duct tape. Those two, that dress and that outfit, both of them are all made out of duct tape. All right? So, now that's way more creative than I would ever be with duct tape, but when I saw it, I had to put it up there. Yes, yes. Duct tape can, and I even, as I was looking for just pictures of sutures, so they show you how to sew somebody's skin back together, I saw a guy that used duct tape, and he just put string in the edges of it, and then tightened it up like a shoelace, and put a wound back together, and it was a deer hunting wound that was big enough that the guy probably would have died, and he put them back together with duct tape and string. So, you'll find many uses for a roll of duct tape in your first aid kit. Okay, and that's also, you'll notice, maybe it's on the next one here, a lot of things that we don't think about or don't think are important, like somewhere in here it says safety pins, and various sizes of, you take one of your old sheets that you have that you don't like anymore, you're not going to use, tear it into 2-inch strips and 4-inch strips. this long. You can leave them longer if you want, tear it to what you want. You'll find that they're very useful in finishing a wound dressing. And you don't think about it, and most people just chuck those out because they don't really absorb anything, the sheets don't. They're perfect for tying off that wound. Now you don't want to do a tourniquet, but, you know, unless it's a very specific situation. But you can use them to tie off those wounds. Then we talked about, and another thing that I say in your first aid kit, you need to have hand sanitizer. You can even put that in a wound and make them scream like crazy, but you're going to sanitize that, that wound. And if you close it up with infection in there, yeah, you'll be lucky if they live through it. If you close it up with a good infection in there. So, and you notice in the middle of that saline solution, have 10 bottles of it. That stuff's $1 a bottle. You can use it to rinse out eyes. You can use it to rinse out open wounds. You can use it just to clean off skin. And so it's an excellent thing to have. Basically, the reason why they balance the saline so it doesn't hurt your eyes, it basically has the same salt content that your body's chemistry does.
And you can spray it with some of that silver.
Yeah.
When you sew it up.
Yeah, and that's an excellent thing to clean a wound with as we get on there. Turkey baster, you'll notice that I have one of those in there. Cleaning out a wound, that's, nobody thinks about it, but we talk about improvising. Turkey baster is an excellent thing to be able to rinse with your saline, rinse out a wound, okay? You know, we were out in the field and my brother got a pitchfork through his foot, and it was a good gash where it did it. And if we didn't have a little bit of knowledge on how to clean that up, or if we were out in an area where we couldn't get him to good care, it went clear through his foot. And so that could have been, you know, quite a dangerous situation for him. When you're in the bottom of a cow poo filled ditch, and you stick you know you got infection in that thing. So those kind of things are, you know, it might not be an emergency for everybody on that day, but it was for him. So other things. Aloe vera can be used internally and externally, and it can be used for a variety of things. And it's a nice, pretty little plant that you can have that you just throw a little bit of water on once in a while. It's an excellent something to have around your house to save you from burn. There's many other things. And as we go through snake bites, it's also one of the home remedies that helps detox your body. The charcoal, it's really recommended that you have some of that in there, but you only use that if poison control tells you. That's one of those things you hope you never need to, but if you do, you know, that $1 you paid for that bottle of activated charcoal could save a kid's life when they ate the wrong thing.
They take that? I'm sorry.
Yeah, it is yeah, they can take it internally, and but that's why they highly recommend only at the discretion of Poison Control Center.
And where do you buy activated charcoal?
Yeah, you can get it. You know, all of this stuff that I saw on Amazon. So basically, I would expect you to be able to buy it also at a health food store. Yeah.
They tell you not to use Epicac anymore to have a child throw up, and that's a never thing. It's not just don't do it unless poison control says not to. They say don't do it.
Don't, yeah. And see, and I've also found it that they've said that Epicac is an old wives' tale, or you know that it doesn't. But I've also found many instances of people using it for various reasons. So I would agree. I wouldn't use it unless...
I used it as a, you know, on a kid a long time ago, but Poison Control told me to do so. So that's one of the things that has been updated, and they say no.
Yeah, and this guy he did research, and I'll bring up his slide in a minute, on what to do when you get bit by a snake. He was bit by a rattlesnake, and shows what he did to keep himself alive because he wasn't around the doctor.
One important thing to always keep in mind with first aid is almost everything can heal and mend except death. And so, you know, Todd mentioned the tourniquet. You don't typically use a tourniquet. But if they're going to bleed to death, and that can make the difference, then you use a tourniquet. when you're doing CPR. If you're doing CPR and you're doing chest compressions, it's not unusual to break ribs. And I've done that many times and broken people's ribs. But the ribs heal, death doesn't. So things like that. I mean, if you've got a patient or a victim that they've ingested something that's going to kill them, that might be your only recourse, to use something like that to at least try to keep them from dying.
Yeah.
But on the tourniquet, if you put it on, you loosen it every hour or something like that to let the circulation
Right.
go.
Yeah, but you're not gonna.
You typically would use a tourniquet if you have a amputated limb just
Yeah.
on the end of it.
Because you never loosen it up once you plant
Yeah.
it down.
Because, that's a good point, because also, in the end of this, when you're putting something on a wound and it's bleeding heavy, you're going to hold that pressure on it for 15 minutes without letting up. Every time you let up, it's going to break all of those clot factors up, and it has to start over.
15 minutes?
Yeah. You know that you're past that. You're past that clotting time if you go that long. But if I go for like 5-6 minutes and I go, oh, let's see if that stopped bleeding, I just started it over again. Okay, it's going to break it loose. It's not all the way closed up. The clotting factors haven't worked all the way. You're going to break it loose, and you have to start over again. So that's a good point, and that's another reason why if you got a tourniquet, on amputated, you're going to want to leave it and you're supposed to leave it. You're instructed to leave it if you go to a first aid course until a professional comes in, and then that's their job. So a doctor of that. So, few emergency things on here. A lot of people don't think about it. Space blanket, candle. If you get stuck in your car in the winter and you have a candle and you can light that candle will give off enough heat to keep you alive. Candle a day will keep you alive. If you have a box of crayons in that car, if you can light it, that crayon will burn just like a candle for about 30 minutes. That can save your life in a frozen environment. Your car goes out. And we talked about a couple weeks ago about a couple that froze to death up in. They had a couple of boxes of crayons that might have kept them alive for a couple more days. So, some things that can help you in an emergency situation, for a family emergency situation, is in your first aid kit, have all of your medical information for each of your family, each of your kids, yourself, in your first aid kit. Now this first aid kit for me was 3 pages long, and I modified it a little bit from Mayo Clinic because they're really looking at something that you're going to have in your house and use. I'm looking at something that you should take with you when you're backpacking, or as we talked about before, when I'm looking at it, I look at it as if we had an earthquake, what do I need? And that's what I looked at on here. So that's why I added a few things on here. Another thing that I really think that, and they cost about $11 again and I found them cheaper on eBay, but an extraction forceps, it's a universal 151 is what it's called. It's a really nice set of pliers is what it is, but you could pull a tooth with it if you needed it. And we talked about, you get an abscessed tooth and you don't take care of it.
Extraction what?
Yeah.
Extraction forceps 151. It's a universal extraction. And I saw them on eBay for $5 to $11. So, which is, I paid 200 and something for mine, so I'm going to eBay from now on instead of my supplier. So. All right. And it talks, and they put in there a small waterproof flashlight, even a couple of your, a flare or a couple of those glow sticks. Those glow sticks will last almost indefinitely as long as you don't break that glass. Once the glass breaks, then your chemical reaction starts. Okay, let's jump over to, we're going to talk about ticks, spiders, and snakes. A tick, when I was a kid, they had all this stuff, put Vaseline on it and it's going to come out. Okay, all those old things you don't want to do. You want to remove this as quick as you can. Okay, because they do carry disease, they can get hooked in, and the further they get hooked in, the worse the issue is with them. And this comes right from the cdc.gov. Okay, this slide is right from them. And they say, get a hold of it as close to the skin as you can, and then just pull it out. Just remove it, and that's why in your first aid kit, always have a set of tweezers. You should. It's probably one of your top 3 things that you'd have in there. Tweezers. Okay. Once you grasp it, just pull it straight up out of the skin. Get as much of it as you can. If you didn't remove all of it, then you're going to need to have. I mean, I guess if you wanted to, and you're out in the middle of nowhere, you can use a blade and remove it if its head's already burrowed into your skin. But usually you can get it, and you'll get the whole bug. Okay. Then you need to follow up, watch it for a month, make sure that you're not getting a fever, those kind of things. If you do, you're going to need treatment for it. But it's that simple.
And Lyme's disease is a lot bigger than anybody knows.
Yeah.
It's huge.
Yeah. So, and I think if we looked on that silver colloid, that said it would treat Lyme's disease too. So you got that around, you can spread that on the skin when you're done with it too. Put it on that wound. And silver colloid is okay for external, internal use, open wound. It's good for any of those because of the mode of action that it does through removing protein. Spider, look around here, the most common is a black widow. When I was a little kid, my mom got bit by a black widow and they didn't know what it was. And she had all these symptoms they talk about. Stomach goes hard, you just get severe cramping, severe pain on it, and most likely you're not going to die from it. If they know what it is, they can give you an antidote. Good luck in finding one. The medical community takes a pretty good... those are a couple of things that they keep pretty good control on. And I don't know if it's because they think that the antidote is dangerous and so they want it controlled, and that could be a possibility. But probably the reason why is because it's expensive and it's usually not life-threatening. Okay, it doesn't... There's even with the black widow, which is the most poisonous that we have around here typically, is not deadly. And I watched my mom go through all this, and she didn't have a good time. And basically, what they'll do is give you a calcium-enriched IV to help, because it basically throws your balance off in your potassium system, your calcium system in your muscles, causes severe cramping. And that's where the pain comes from.
Todd,
Yes.
our son got bit by a hobo spider down in Provo, and he didn't realize what it was in the beginning, but it eventually turned to almost MRSA. Very, very difficult to eradicate, very painful by the time he got rid of it.
Yeah. My daughter, about a year and a half ago, got bit by a poisonous spider in the back of her leg. I told her it was a mosquito bite, so she didn't freak out. But it turned into a pus unit about that big that I had to drain quite a few times, put antibiotics on it. And then the spider had a virus too. So for a year and a half, she'd have little vesicles pop up all over her legs. And what finally got rid of it was taking her to the swimming pool. That chlorine in the swimming pool cleared it up within weeks, and it was a year. Scorpions, even the most poisonous, unless you're a little kid, they're not deadly. They're not dangerous. They hurt, and they can hurt for months. And that heat can help reduce, move that poison out of there and get the tissues back to normal. But if you have a small kid, you can try to keep them immobilized and get them to a hospital, but that's the only remedy. There's nothing that they say that you can take to really get rid of it. Snake bite. The most poisonous around our area is the rattlesnake. Most of the time, statistics in America, 8,000 people get bit by a rattlesnake a year. 13 of them died last year. So it's a very low number. And they don't have any background statistics on who those were that died compared to the other people. But basically, you get bit, you want to immobilize, get them run around real quick. No, I'm kidding. That's what kills you. You freak out and you go run. Get that heart pumping, and it's going to move that poison. And actually, that poison is too big that it can't penetrate. It can't penetrate blood vessels and get into the blood vessels. It actually gets pushed through the muscles and that into your lymph system and works its way back to your heart through your lymph system. So, don't get excited. immobilize the area that's bit and keep it below your heart. Because then it takes longer for your fluids to go through those tissues to push it back through those areas.
So steps 2 and 3 are much more realistic.
Yeah.
Step 1, you're gonna get excited.
Yes. I mean, they even tell you to put a splint on it if it's an area, but just because it helps you immobilize it. You know, you get bit on the foot. When I was a kid, my dad got bit by a rattlesnake on his boot, so it didn't get him. And I was walking behind him. He goes, "You get out of here and go on the road." And I'm like, "What?" Then he had my uncle go get a shovel and cut his head off, and but this was just up Logan Canyon, and he was lucky he was wearing a boot. He said he could feel those fangs scratching his skin, but it didn't get him. So I guess we've tried it all at my house. Black widow. So you want to immobilize it, keep it below your blood level, and relax, okay? They used to have, and you can actually still buy them, snake bite kits, where they say put an X. And okay, Mayo Clinic, CDC, all of them say don't do that. You're not going to get anything out of it. So I guess you can take that for, when I used to do biochemical research, I did find that a lot of what was in the medical community and research in medications, they kind of kept to their own, and if it was outside remedies, they discounted it. But they didn't realize that all of their medications that they get are from an outside remedy that they decide that they have figured out in nature, and then they replicate it in their lab. So there's a lot of research now that they're kind of going backwards on, like that silver and that kind of stuff. One of the old wives' tales is drink caffeine or alcohol, that's going to help. No, it's going to make it worse. You can drink a lot of water because it'll help dilute and push that system and dilute it out of your system. It's one of the things that they do.
What's the time frame that you need to get help? Sounds like a rattlesnake.
Okay, yeah, and that's a good point. Good question. If you are going to run to the hospital and get the antidote, it needs to be within 2 hours. It's not going to be effective if it's outside of that. You're going to go through all the terrible feelings and that, and then plus or minus, are you going to pass away? Die. Is it like I said, 12, 13 out of 8,000 last year? And the average per year is about 8,000 people get bit by a rattlesnake, bit by poisonous snake. And so it's very low, okay? Okay, this Pat Moss guy is a guy that got bit by a rattlesnake. This is what he said on his research to going through and home remedies that many people have said have worked for them. I'm not going to go through every one of them. It's on the website. And he went through it and he lists it. And I even think you might see Ipecac on there. I'm not sure. One of the most interesting things that I found was that the powder from pineapple, that it actually dissolves and disables the snake venom. Okay, but basically all these things will help dilute the snake venom or help you be stronger to withstand as your body clears it out itself.
It's also one of the natural best painkillers is the bromelain.
So keep a pineapple with you, I guess. But I'm not going to go through every one of those because I found actually quite a few places that talk about home remedies. His was the most complete, and he said he did the research because he was bit by a rattlesnake when he was out in Arizona, and he wasn't close to anything that he could go to the hospital. So he did all the research on it after he lived through it and said,
"This is the last one."
Yeah.
Prayer.
Prayer. Yeah. Okay. Okay. In this last few minutes, let's talk about taking care of a wound. Okay, and I have a little crescent moon right there on my hand that had 3 stitches in it. So stitches. It doesn't have to be a big wound for it to bleed a lot. I stuck a glass rod when I was doing chemical research. I stuck a glass rod through my hand and you could see it pushing the skin here. So it wasn't big and wide, but it was very deep, and it bled and it bled and it bled, and we had to put stitches in it to get it to sit right and to heal right. So if you have a wound that, and this is it looks like a dog bite to me because I can see the canine teeth on it. But if you got a wound, the first thing you got to do, whatever that wound came from, you got to clear the debris out of it. Okay? If you see a big old piece of rusty nail in there, or you see a nice piece of glass, or you know, you're out in the cow pasture and you get some barbed wire in it that's 3 inches, you got to clean it out. If you're going to sew, like I said, if you're going to put it back together with infected stuff in it, you're doing them worse than to leave it open, because it'll flush itself and at least clean itself out if you're doing that. So if you're looking at it, this is where that turkey baster comes in, and also the colloidal silver is an antiseptic. That's where when you're done flushing it out, you can put some of that on it, and it does work. In that first aid kit, you'll notice that there were 3 or 4 different kinds of antiseptics and antibiotics that I have in that kit for different uses. This one's kind of a catch-all that up until I started doing some research on it, didn't think very much of it, but I've seen that it's coming back into the mainstream because they're finally figuring out what it does. Okay, so after I've cleaned it out, I see any debris, I pull that out of there, and they're screaming at me and they're mad at me. Actually, a lot of times when you get a wound that big, it's going to kind of go numb. When you poke on it just right, they'll jump, but it'll go numb. So you can do the work you need to without torturing them as much as you think you're going to. Okay? You want to take any glass, any pieces out of there, take your turkey baster, rinse any dirt, any debris out of there, and then you need to wipe it, and that's where you come up with the antiseptic. Whatever that is, if it's an alcohol swab, alcohol rinse, colloidal silver, you need to do that. Kill that bacteria that is on that surface, is there. It's on your skin, you get a cut, you just put it into that cut. Okay? And so you're going to clean that out. Then you want to take and stand.
Well, I didn't want to interrupt that part of it, but I was just going to say that part about you talking about it going numb. I experienced that firsthand with a cut on my head that was about 4 inches long and almost to my skull. And they stitched it up in the emergency room without using any painkiller at all.
Yeah. And I think, yeah, you say cat gut?
Yeah. Are we
That's-
supposed to have cat gut on him?
I've got some right there.
Well, you do, but
Yeah,
I don't.
well, and
I'm not a dentist.
Amazon.
Amazon.
You get
Yeah.
all cat.
You know, if there's enough interest, I thought about putting this first aid kit together, because I can buy it in bulk at my price, and then see what it comes out to be. If I can do that, I'll put a certain amount of them together, and your cost is my cost. What's on that list? I thought I was going to go through and see what I can get for bulk, see how many I could do, and divide that up. So if you want one, if there's enough interest, I'll make them. And in that, also, I didn't say it, but in that, I recommend that you have 3 to 5 sutures in there and a set of hemostats. And you hope you never need them, but if you do, I had a neighbor that used one to soap his horse's leg the other day. So that's another use for it. Cat gut's great because it'll dissolve itself away over time. I use silk in certain situations because cat gut irritates the tissue a little bit, and the tissue secretes proteins and enzymes that dissolve it away. That's how it works. So if I don't want it to be inflamed, then I use silk instead.
You're going to get into the glues.
Glues, there's a lot of glues, and no, I'm not going to get into them. I got 5 minutes. But so
I had surgery on this when they put in that 7-inch piece of metal, and all they did was glue it.
Yeah.
And put those strips of Steri-strips across it.
Yeah. Yeah, and see, I have a friend that he used super glue to glue his own leg together. When he got to the hospital, they said, looks good, we're not going to do anything to it. So they just put a dressing on top of it. But that wasn't even the FDA approved stuff, that was the crazy glue. But it saved him. Okay, once you've cleaned that out, you want to get those tissues appropriated to each other so that they're laying flat or even as best you can. This bottom one on that bottom right, I guess that'd be your left. That's a terrible job, okay? If you want a nice war wound and you want a nice scar, that's how you do it. But if that's all you can do, and you're scared to death to do it, that's better than letting them bleed to death, okay? If you look at this one on the top, I gotta think of your side, top right here, that stitch job actually looks pretty, not too straight in that, but if you look at the wound Lying, it's straight on, nice and flat, there's no bubble on it. That's a beautiful job. Those stitches will go out and those little dots will turn into just, you won't be able to see them. This bottom one, when you do a stitch on that, if you're going to put a stitch together, and I've got oranges here, I'm going to hurry so that those that want to stay, I'm going to let you guys go through and do a stitch, because these are just like, you stitch in oranges, just like stitching tissue. So you've done it once, you can do it on. But the person on the bottom pulled the stitches too tight when he's doing his, okay? And what it did is it balled up the tissue and pulled it together, and that's why you have the open edges in between, and that's going to be a really ugly or beautiful if you're, I don't know, one of these people that love the goth. That might be a sweet goth. You can run a few, but it's not a pretty, it's not going to kill pretty.
It looks like infection.
Yeah, and that's another point, an excellent point, because if you do this, now you've left open edges that are very prone to infection, whereas that top one up here, when it's put together, those tissues, they will have primary closure that close within a day. Okay, that's how quick that outer surface will be. In a day, you'll have primary closure. It won't be very strong, but it's going to be closed, and then if it's antiseptic inside, you can keep it antiseptic on the outside. That's how quick it'll close. That one on the top, you're going to have to wait about, or sorry, on the bottom, that's not going to close for probably 2 weeks.
On the bottom, could you go and just put another stitch in between all of them?
You would like to, but the problem with it is that the stitches that are there are already too tight. So what they did is the tissues are supposed to be this far apart at that point, and they squoze them together, and so now it bunches the tissue and causes that. So what you got to do is loosen that stitch up a little bit, and it'll let those tissues relax back down in.
So if that arm came to you, you'd start over.
Yeah, I'd take that out and I'd get them to take it out and do it. Or I'd get in trouble because it was on somebody's face or on somebody's arm instead of their mouth. But if you can do a stitch in a mouth where it's the most delicate tissue in your mouth or in your body, you could stitch anything. I watched my brother stitch his thumb by himself. He's the dentist too. He borrowed one, or got an old gun from my grandpa. On the first shot, he went, and the slide went, and he just went. I'm going, you want me to do it? He's going, no, that's all right. But so he did. So this girl, I guess that picture's known as. What if I could blow it up here? No, I won't blow it up. I was going to say that looks pretty good. The stitches look nice, but they didn't get the tissue right together. So now she's going to have about an 1/8 of an inch scar and a divot across her face there, because the stitches look beautiful on that one, but they weren't quite tight enough.